Okay, so we are going to get into this. So the purpose of tonight's call is a Q&A on perimenopause and menopause, linked in with exercise. So first of all, Fiona, if you want to introduce yourself, that'd be brilliant.
Yes, right. Hi, Dave, and hi, everyone. And thank you so much for asking me to come along and talk. I love talking about the menopause and perimenopause, and I love sharing this information. So I'm delighted to have the opportunity. And I really love the connection and the way that exercise works with perimenopause. So I am a GP and a menopause specialist, and I live in Glasgow, and I work in a Hollywood private clinic, and I have got 25 plus years in dealing with menopause and perimenopause, and have seen the changes in the management of the menopause and in the treatments available, and such a wide range of changes have happened in that period of time that it's such a super thing to talk about. I love the questions that you've compiled. And as I said to Dave, every one of those questions, you could probably speak for an hour on each one of them. So I'm hoping that I'll give you some really useful information that's going to help you kind of understand all of this and appreciate the connection with exercise and menopause.
Okay, brilliant. And then with that, Fiona, then what I'll do then is I'll start off with a few questions, and then afterwards, Fiona, if you would ask me some questions as well, and as I say, if anybody wants to butt in at any stage, like feel free. So I think the opening question then would be, what are some signs of perimenopause, and what age can they start at?
Mhm. So great question. And like so many things to do with perimenopause and menopause, it's not a black and white answer. There's not a yes or no, and there's not definite age. There's not definite symptoms. There's a whole wide range of symptoms. So years ago, when I started in this field, basically it was if you had flushes and sweats and you were in your 50s and your periods had stopped, then you were menopause. If anything else had happened, that wasn't really, nobody really thought about menopause. Now we realise that it can be a wide age range can happen. We also realise that it's more than flushes and sweats, so much more than flushes and sweats. So even some people don't even get flushes and sweats. So things like anxiety, so like a new anxiety. So it can be somebody who maybe has, always had a bit of anxiety and finds a different type of anxiety, or it can be somebody who suddenly just develops anxiety and they've never had it before. It can be a crippling anxiety. It can be life affecting. Strangely, car anxiety is one thing that a lot of women will talk about. Strange as it may seem, the women who have been happily driving and directions and motorways and things, they suddenly find that they actually feel really anxious when they're driving. So anxiety, sleep disturbance is really common. Um, Brain fog, irritability is really common. Joint pains are really common. So things like generalized joint pains and muscle pains, but also like frozen shoulders are more common. You have a lot of estrogen receptors in your joints, so it can actually cause a lot of problems from that point of view. Um, Sleep disturbance is definitely a big one. That what also happens is we get what we call genital urinary symptoms. So vaginal dryness and irritation can be a big problem for many women. Urinary tract infections. So there's probably about 40 symptoms that we can get of menopause, itching, skin problems as well. The average age of the menopause will be 51. But we think there's about a 7 year run up in symptoms. So your periods might stop at the age of 51, but for 7 years before that, you can have these subtle symptoms that start developing. Um, Also, in recent times with treatments for cancer. So many women will have premature menopause. So you can even have it's not an age thing necessarily. So in any time from sort of from your 40s isn't considered an early menopause, but some women even under 40 who've had treatment for breast cancer or who've had surgery for things. So what I'm really saying is it's not necessarily an age thing. The old-fashioned idea was it was when you were 50 and you had flushes and sweats. So I suppose that wide range of symptoms, wide age range. You can still be perimenopausal and have regular periods. Some women find a change in their periods. Maybe they get shorter or maybe they get slightly more irregular, but your periods don't have to stop to mean that you're in the menopause. So, as I said at the beginning, it's a grey area and you're looking for changes. And so if you are in your 40s and you get changes in your periods and you notice maybe that you're not concentrating as well, you may be a bit irritable, a little bit more tearful, then there's a really good chance that you're perimenopause.
Okay, brilliant. Thank you very much for that. And the next question then would be, what treatment options are available for women going through perimenopause and menopause, and is there a benefit to seeking help early on?
Well, that's a great question as well. And yeah, there are treatment options, and it really is quite individualized as what somebody might want to try. I mean, the reason that you will be having symptoms is because your ovaries aren't producing estrogen anymore. So, estrogen or hormone replacement therapy is what's really going to help your symptoms. Um, but not everyone wants to take HRT. Not everyone wants hormones for various reasons, and not everybody can take them. If you've had a history of breast cancer or maybe blood clotting problems, there may be reasons either you don't want to take the HRT or you can't take it, but HRT will be the gold standard for replacing what your body is no longer producing. It depends also what symptoms you're wanting to address. So if you maybe can't or don't want to take HRT, then you might have sleep issues or anxiety issues that you might want to address, and you might think about sleep hygiene, what you might do there. You might think about what you're going to do for anxiety symptoms, whether it's going to be, psychological therapies or, that type of thing. It depends what symptom you're really wanting to address. But if you don't want to or can't take HRT, then there are other medical options as well, other medications. They would be things like, well, this is probably going into a wee bit too much detail, but some antidepressants, and this is a useful point actually, because some antidepressants do help with flushes and sweats. But a lot of women will sometimes feel that they're being fobbed off with an antidepressant, but we're not using it as an antidepressant. We're actually using it for its sort of side effect, if you like, for flushes and sweats. There are also a few newer medications that have been developed for flushes and sweats. So it really depends what the symptom is you're wanting to prevent. But HRT would be sort of the gold standard for it. Along with that, you might want to think about some supplements. So sometimes, people think about supplements. Vitamin D and calcium are always good to take, and sometimes magnesium is beneficial for sleep. But supplements is probably a whole other category. But the ones that I would recommend that there is evidence for would be vitamin D, calcium, and magnesium, maybe omega-3. Yeah, that's a whole other
Okay.
can of worms, really. That's maybe yeah.
All right. No, that's brilliant. That answers that really nicely. And then the next question, then, Fiona, would be, how can perimenopause and menopause affect muscle, bone density, and body composition? And how important is resistance training during this stage of life?
Yeah. So muscles and joints and bones love estrogen and they've got lots of estrogen receptors. So when your estrogen levels start to decrease, then your bone density will start to decrease, and your muscle mass will start to decrease. So with bone density, you will have your maximum. So genetics play a big part in this. So you will have your maximum bone density in your kind of mid 20s thereabouts. And the way you get your maximum bone density is, genetic and also diet. So kids making sure they have enough calcium in their diet, exercise, not so many fizzy drinks because that's not good for your bones. So optimizing your bone density, and then after that, you have to try and stop it from decreasing to a level where if your bone density decreases to a certain level, then that will be called osteoporosis. And osteoporosis is an important term because it means thinning of your bones. So, osteoporosis doesn't cause pain in your bones. Osteoporosis makes your bones weaker and it makes them more likely to break. So, if you have osteoporosis, you'll get a hip fracture, a wrist fracture, or a vertebral backbone fracture. So that's what happens with osteoporosis, and you want to try and prevent it. So lack of estrogen makes your bone density decrease. So, as you get towards, so it gradually decreases from your mid-20s. Then once you get to perimenopause and your estrogen level goes down, it decreases much more steeply. So if you want to try and prevent that, you might think about HRT because there's really good evidence that HRT decreases the risk of osteoporosis. You want to make sure you're taking vitamin D and calcium, and you're also wanting to make sure that you're putting stress on your bones because that stimulates your bone cells to produce more bone and strengthens your bones. And so you want to be weight bearing exercise, so jumping up and down, that kind of stuff. But you also want to be using your muscles on your bones. So where your muscles attach onto your bones, you want to be stimulating activity there. So that it stimulates bone growth. So that's where our strength and conditioning comes in, moving all of those kind of muscles on the bones. And then the other thing you want to do is muscle mass also decreases in perimenopause and menopause. So lack of estrogen decreases the amount of muscle mass you have, and then that affects your bones, and it also affects your body fat to muscle ratio. And then if you have more fat to muscle, then you will find it harder to metabolize calories and you will find it harder to lose weight. So it's all interconnected, the bones and the weight loss and the muscles and the activity and the osteoporosis are all connected. So strengthening up your muscles by resistance training and also then increasing your protein intake will help your muscle mass, and that will help your bones, your muscles, your coordination, your balance, and also weight management as well.
Absolutely love that. That is a great answer to that, and that really collectively answers everything from even from my sort of expertise with exercise, as you say. The exercise not only increases the bone density, but it also increases the muscle mass, which then reduces the body fat, which then increases the metabolism. So yeah, I
Mhm.
absolutely love that. Like that
Yeah,
is
yeah, I
fantastic.
think it's kind of a reflection of what I was saying about when I started working in this kind of field. We used to think it was flushes and sweats and your period stop. And well, also when I started working with this, it was if you want to lose weight, you've got to burn up more calories and eat less calories. And that was it. It was kind of as bland as that, as non-specific as that. And it actually didn't really ever really work at all. And then it was only when we realized that, it's not about the type of calories, but it's not about the count of calories that you take. It's about the type of calories that you take. It's about your protein and your type of carbs and stuff. So, it used to be just what women would, just eat less and then they would just exercise on a treadmill or do something like that. Well, now that aerobic exercise, which was all, when I was younger, it was just, you did aerobic classes and there was no kind of, no weights involved at all. Weights was for men, really. I don't know, weightlifters or whoever, but women didn't really do strength and conditioning. And now kind of we know so much more about how all of that works, and hopefully it makes it easier for us to manage the weight and manage those sort of osteoporosis risk factors, and then getting into the cardiovascular risk factors as well, which we haven't even mentioned, but we might do that if there's time.
Yeah, I suppose just touching upon that before I ask you the last question as well. You mentioned there about like a lot of it was like aerobic type of activity for females going back definitely, 80s, 90s. It was only over maybe the last 10, 15 years it was popular for female, I suppose, to weight train. But I
Yeah,
suppose with that, it's like the same exercise stimulus, so therefore aerobic, and then women plateauing. But what they do is they do more of the same but the result is still the same because they're doing the same thing, but they're expecting a different outcome. Whereas whenever they're combining it with strength and the cardiovascular exercises together, support it with the nutrition, the rest and recovery, is what
uh-huh.
gives the longevity, I suppose, of the weight loss management, the bone density
Yeah.
increasing, all of the above. So yeah, that all makes sense, doesn't it?
Yeah, well, it does. And I don't know, I mean, you'll all know this as well, but I mean, a strength and conditioning class is a cardiovascular class. I mean, my heart rate is, rockets with it, and palpitations a lot. I mean, it's certainly a cardiovascular workout. It's not like you're not. But you used to think like weights wasn't really like that. It was just,
Yeah.
you just do the weights, but it's a cardiovascular workout as well.
Yeah, anything basically that elevates the heart rate is deemed
Uh-huh.
as a cardio workout, if you like. But I suppose with the actual the resistance training, it's the afterburn, which a lot of people forget about, and it's the
Uh-huh.
afterburn. It's like when you lift weights, that's soreness in your muscles for like a couple of days afterwards. That's your body basically anabolizing. It's the muscle tissue recovering, and therefore it
Mm-hmm.
needs the protein, obviously, and the amino acids for the building blocks of the protein, but it's also using calories to repair. So the more muscle mass that you have, it uses more calories to preserve that lean muscle mass. So it's like, whereas if you go for a steady state run, once the heart rate stops, that's kind of the end of the burning phase. Whereas the strength training, you're burning for, I think it's like up to 48 hours afterwards, depending on what the intensity of the exercise was. So
Right. Right.
all of that is like so as you say, it's cardio done in a weight format. It can be done in whatever, like running, but it could be a mixture of weights or whatever. Um, and I think that's why it's so effective. Women using weights, women and men obviously, but like using weights and
Mm-hmm.
cardio combined for the maximum output. I love that. It's brilliant.
Yeah. That's a super way of explaining it with your muscles, yeah. Yeah.
Yeah, it's class. And then the final question here for you. So, if a woman thinks that she is perimenopausal but doesn't know yet, where to start? Where would you recommend she would start first of all? So, like, what would you suggest be the first thing that a woman should do if she thinks she's perimenopausal?
Well, so I suppose there's a practical and then a theoretical sort of answer to that. So in an ideal world, you will arm yourself with all of the useful resources, reliable information that you can get. So, the more that people are talking about that perimenopause and menopause is great because what you really want to do is when you're younger, when you're in your 30s, you want to arm yourself with this information about what you might expect. You want to try and be maximizing your bone density and getting into the right kind of exercise regime and nutrition before this happens rather than wait until it happens. And then you want to find reliable sources of information so you can recognize the symptoms like we're talking about you know and if you recognize the symptoms and you've found out some good information about what the treatment options are, then if you could have like thoughts about that before you go and see your healthcare professional, whoever that might be, then and the problem is that there's such a variation in the services that are available. So, you could go to your GP and maybe they don't really have a special interest in menopause or perimenopause. They don't know a lot about it, or you might go to somebody who does. But I think if you don't know what resources you have, then if you have a good idea, even write a list of your symptoms. It's actually quite helpful if you have a list of your symptoms, and you have an idea of what treatment options you might like to explore, and you know a bit about your family history. You're able to say, maybe you do, you don't have a family history of breast cancer or blood clotting problems or whatever. So sort of arming yourself because if you go to a GP appointment, you'll usually have about 10 minutes or so to talk about it. So if you can sort of cut to the chase and have that info ready and available, then that helps, for a better conversation.
Yeah.
But I think for me, it's making sure you have reliable resources to arm yourself with all that information, so that you kind of know what to expect. That would be my
Yeah, I like that. So basically, like to summarize that, if you are making an appointment, it's like the top five symptoms, or whatever, go in order of the ones you're struggling with first and foremost, as opposed to going in and just saying like I'm just not feeling myself. It's like actually
yeah.
listing the symptoms down as and when you feel it. So you got a list in case you do go in and you have a bit of an aloof moment, I suppose. That's
You
brilliant.
might have
Yeah.
a bit of brain fog because that's one of your symptoms of
Yes.
perimenopause, or you might have a bit of anxiety. And sometimes you maybe don't want to feel like you're telling the doctor, what to do. But it's actually incredibly useful if you can come with a more succinct kind of list of symptoms. Tell us a bit about your periods, what's been happening, and have an idea of what you might want to try. It's actually incredibly helpful to the doctor, but as well as you, you'll get more out of the consultation if you're able to do that. I don't know if that totally answers the question, but you might have more
Yeah.
questions
Yeah.
about that at the end, which is great if you do.
Yeah, no, I think that answers that perfectly. Well, thank you, Fiona. Um, do you want to ask me a few questions then?
Yes, I would love to. Um, so I suppose what stimulated us having a conversation really was me recognizing that you had had some very good successes in your gym. And one of the commonest reasons, one of there's some, I suppose, a couple of three or four common things that people come to see me with, or that we always talk about in a menopause consultation. And it'll be their symptoms. Anxiety would be a big one, but weight gain, and tiredness and sleep and anxiety would be big symptoms. So women will come back again and again when they come back for reviews. We'll talk about this, and so what I was curious about really is what makes a successful exercise program work? What are the ingredients do you think that make it work?
Yeah, well, I suppose first and foremost, on paper, there has to be a structure to the program, but in hindsight, it also has to be realistic to the individual. So, like for example, like whenever some people come on board, like the goal is like weight loss, but whenever you start working with them, sometimes what can happen is there's actual a stabilization period which is required, and a stabilization period can delve into a lot of different things, such as um, like movement patterns, mobility issues, um, mind to muscle connection, and just even getting like to grips with like getting into positions that they wouldn't normally be able to. Like for example, like a body weight squat breaking parallel. There's a lot of people can't do that. Things like stability issues as well. So it's like it's kind of like crawl before you walk. So some people have to like bring it back into like a longer stabilization period than others, and then some people are maybe further ahead in that stabilization period. So therefore, their results are going to come on quicker. But that's also going to be aligned with also other things like lifestyle factors, um, time factors, rest and recovery factors, age, genetics. There's a whole sort of multitude of things that come into play there. But I suppose first and foremost, it has to be structured. The program itself has to be structured, but it also has to have variance to the program, and it has to meet the individual where they're at currently. Therefore, there may be individualized um, exercises required for that particular client. So, for example, like in our group sessions, you might have, I'm just going to go down to like a squat pattern. So somebody could be doing a barbell back squat, somebody could be doing a goblet squat, somebody could be doing a squat off a box to take the stabilization out of it. Somebody could even just be focused on opening up their hips. So there's different variants to the program. So I suppose what makes a good program, it's personalized to the individual to meet them exactly where they're at. So there's like no like one answer to that. And I suppose the only way to figure that out is to actually start working with a person there and then, but also to set the expectations from the start. And that obviously comes from like the questions that I would ask them before they join the gym. I'd be like, what previous history have you got? Like, what have you done in the past? And you can kind of get a general consensus from them, what they've done based upon what they tell you. And then whenever you get them in and you get to see their movement pattern, you can basically tell from there like how quickly the results are going to come on, and it's also dependent on the nutrition side of things. So if it is fat loss is drive through nutrition. Exercise will get you so far, but it'll plateau if nutrition isn't aligned with the exercise program. It's
Mm-hmm.
also to do with readiness as well. So like some people think that they're ready, but they're maybe not quite there yet. They maybe um, there. They're maybe not quite not there yet, as in they tried the gym and then they realized that like maybe it's just not for them, that maybe it's they maybe need to go back to more basics like general walking. So walking's one of the ones it's like it's underrated for some reason, but it's one of the
Yeah.
best exercises for burning fat, but also the mental health benefits as well. So some people just aren't ready for the joiner program, and that's absolutely fine.
Yeah.
So
Yeah. I like
that's
I like the way you kind of emphasize, and it's a bit like, when I see women at the menopause clinic too, there's such a variation in people's aims and in their symptoms and in their individual makeup. So varying things, even like in a class, where you've got people you can I'm liking hearing you saying about how you can slightly vary what each person does, and that kind of feeling that you can do that without feeling bad because you're not doing what everybody else is doing, or you're not doing, what is sort of expected. You're doing what you can do yourself.
Yeah, and I think as well, like with that, you have to like sort of at the start make it known like some people will get there quicker than others, but eventually everybody gets there. Some people just take that wee bit longer than others, but it's about setting the goals. They're just in competition with themselves. So it's like setting the small wins first of all. So a small win could be like, for example, like turning up to 3 sessions in their first week. Like that is like a big achievement from never being in the gym at all to turning up to 3 sessions. And then from there, it could be like, another achievement could be drinking a liter of water every day, something that they weren't doing before. And then the next thing could be like moving on to the nutrition aspect. It's like, right, education around calorie tracking. Because the calorie tracking is obviously to get you from A to B the quickest possible way. Like the scientific approach to calorie tracking is what's going to help them get into their calorie deficit without guessing. So it's like educating them around food groups as well, like letting them know that like eating bread is not going to put on weight, or eating after 6 p.m. the calories don't like double after, all that, like debunking those myths.
Yeah.
So you're
I mean
giving them
that
the
yeah,
bigger picture.
yeah, I mean that quite nicely sort of leads on to the next question, which you kind of nearly answered in a way, like how can I judge my progress? You can judge it by just making small improvements, small
Yeah, I
advances.
think like for judging progress, you've got like the metrics based, so that like is like obviously like the scale weight, which a lot of people like focus on. You've got your in-body results as well, which has been a big success since we introduced the in-body. So people love to see the bigger picture now, like a 360 approach. So it used to be all scale weight, and now it's like about their muscle mass going up, their body fat percentage going down, their bone density increasing, their visceral fat levels going down. But then also when it comes to like their in body, they like to see where they're losing the body fat from, and it shows you that on the graph, like what percentage of body fat is it being, is it coming away from? Is it from the trunk, or where is it coming from? And also with the muscle mass as well, it's like some people have like they're maybe deficient in muscle mass in certain areas, and then when they see the muscle mass going on, they see exactly. So some people are definitely driven by data and metrics. But then there's also the other side of it. It's like the clothes, like how's the clothes fitting on them, like how's their energy levels, like what's their mood like, what's their sleep um like in general, like what's their confidence like? Because most importantly, like it's always to do with somebody's confidence. Whenever they come on board, it's usually they want to lose weight, but the underlying issue is always the pain issue, and the pain issue always comes from the confidence, and the confidence is down because they've got weight gain, but the weight gain has come from like obviously there's age factors, but it's usually lifestyle factors, or maybe just not the unknown. Like you talked about the aerobics back in the day, like everybody just done the one thing because that's what they did, but
Mhm.
nobody had actually any education around exercise or especially
Yeah,
around
yeah,
nutrition. So,
yeah,
um, so I
yeah.
suppose like, does that answer that? Yeah.
It does answer that, and it answers it really nicely because you can see that there's two parts to it. There's actually the data driven, what you see from the measurements, but also like how you feel. And what I
Yeah.
was thinking about when you were saying at the end there about aerobics, I kind of wonder are things changing a bit with the generations because younger people, it'll be interesting to see because younger ones are all doing their strength and conditioning stuff. They're much more homed in on that, and they're much more homed in on their nutrition. And also, we're talking a lot more about periods and perimenopause and things that people would have been embarrassed to talk about before. So I wonder, are the younger generation wonder how their menopause, wonder what we'll be talking about in years to come. It might be a different story, and hopefully it'll be a
Yeah.
better story. Yeah, as
Yeah.
to
Well,
bone health
I
and
yeah, well, I mean, most of our sort of clientele are females, but from what I can see, especially like since COVID, we're getting a lot of younger women in their 20s joining the gym, which we never would have had that before. So there's actually women, like we're even getting university students as well joining the gym, and
Mhm.
their social aspect is actually training now.
Yeah.
So it's the gym, it's going to runs, like running's really popular now. Like running is very, I think High Rocks basically made that very popular. So a lot of younger ones,
Mhm.
like they're not into the partying this as such the same. A lot of them are into actually investing in their health and how they feel and how they look.
Yeah. And in
And I
their
think
nutrition
Instagram
as
has had a big
well.
part.
Yeah.
Yeah,
Hmm.
yeah. So I definitely think the generations from now moving onwards are going to be in a much better position because the women are definitely focused on training. Like most of the younger women now are physically active.
Yeah.
We definitely
Um,
see that. Like so, it's good sign.
yeah. And the other one that might be relevant to them as well, and to all of us is, the concern that if it's about weights and strength and conditioning, that will I bulk up if I do that kind of exercise?
Yeah, love that question. So that's like something that like I've been hearing for years. It's like, Dave, I don't want to get bulky, and like I kind of say to them, well, in order to increase like lean muscle mass, it's actually quite hard. It's
Uh-huh.
easier to lose it. It's easier to lose it than it is to increase it. And what I would always say to them, like to increase muscle mass, it's a certain style of stimulus training that's required, but it also has to be over a prolonged period of time. But not only that, your calorie range actually has to be in a calorie surplus for the muscle mass to grow, but it also has to be supported with the right amount of protein and the right amount of carbohydrate, rest and recovery for that muscle mass to
Um,
grow. So the question is, are they going to get bulky? Is no, but if they're overeating, they're going to put on body fat, and getting bulky, muscular, and putting on body fat is two different things. So if you are overeating, yes, you will put on body fat, but that's going to happen even if you're not training. Do you know what I mean? So I
right.
suppose my question to them would be, I'd be more concerned about losing muscle mass and losing bone density more so than what it would be of increasing my muscle mass, especially if you're perimenopausal or menopausal. Do you know what I mean? So that would
Right.
kind of be my take on it.
Yeah. That's really interesting. I've got a question which is slightly off the um off the brief, but you've just got me thinking now about. So I think I think the rugby players were probably ahead of the game with strength and conditioning to me. Like that's what some of the PTs and things that I've come across, they've been doing those kind of things that I do in strength and conditioning. They've been doing those things all along forever, um, and obviously building up their muscle. But they must eat a lot then to build up their muscle bulk because clearly they do that stuff, and I'm sure they do lots of other things. They build up their muscle bulk and they probably just eat loads and loads and loads. Would that be right?
Yeah, yeah, definitely. For performance wise, they need to have a certain amount of muscle mass for in order to hold themselves up on the field. But it's the calories that would have to be so that they would obviously be all scientifically added up, but it would have to be
Mm-hmm.
their energy output to make sure that like because they're obviously expending a lot of calories with the training and the rugby, but they would have to hold a certain amount of muscle mass for strength reasons as well.
Uh-huh.
So yes, they definitely will be. In a calorie surplus to a certain extent, but the way rugby and a lot of those sports has went now, it's performance based, which means then it has to be more technical and skill based. Whereas before, rugby players, as long as they were big, they were just genetically big.
Right,
Even if they were carrying a lot of body fat, it didn't really matter. But now it does matter because most of the rugby players are athletic, so they've got speed about them now. So you can't just
right,
get away with just being big. You have to have the whole bigger picture. So what you'll find now is a lot of the rugby teams now will the dietitians will be on it. They'll not be allowed to be carrying excess body fat and things like that. Like if you look at even if you watch the Six Nations there, like it's only really the props that are carrying the extra body because they need that. Do you know what I mean?
right,
So
right,
yeah.
right. Anyway, sorry, that was off the point. So my final kind of questions, what would be the common reasons that women don't achieve their goals?
Yeah, so I suppose I mean there's so many different answers to that, but I suppose one of the big ones is like the all or nothing approach. So like we can all be guilty of it. It's like, you start a new project and it's like you're so determined, you're so motivated, and you go all in, and then next thing there's a curveball, which life can throw curveballs at you, as we all know. So life gets hard, and then you default back into like falling away with nutrition. That's always the first thing to go because you're busy, you're stressed, whatever. So the nutrition goes. And then because the nutrition goes, that habits went. So subconsciously, the exercise starts to go as well. So, that is definitely like one of the main factors. It's like an all or nothing, like a bad week, and they're like, oh, well, it's been a bad week, and then they kind of give up. The other thing as well is not seeing the results quick enough. And I suppose that that relates back to yeah, what we talked about at the start there about the stabilization period, where like
Hmm.
they might still be in that stabilization period, or the lifestyle factor that they are still currently in doesn't allow them to progress as quickly as what they like. For example, they still have responsibilities which are taking up their time, so they're not able to be as active as what they would like to expend the amount of calories that what they would need to do to reach those certain targets. Again, we're reflecting back to metrics. So that can become a thing and it can play with people's heads. And then as well, people losing their vision as to why they actually started in the first place. So like, why did you start? And a lot of people do lose track of their vision. Um, but I suppose that's where the accountability comes in. It's like, well, reminding somebody like what was it like before you started your fitness journey? How did you feel? Like they obviously didn't feel great. It's like, well, it is hard now. You're going through a bit of a hard spell. There's a curveball, but think about like how much harder it would be if you gave this up completely and you went back to where you were before and maybe further behind again. So it's like about setting that vision and about giving a realistic expectation, but also being there to let them know that like this is part of the lifestyle journey, but bringing in other members who have been through it. Like there's some members on this call have been with me quite a long time, and they're able to chat to other members and say to them like, once you've been through like all 4 seasons, like you know what it's like to come back after Christmas, you know what it's like to come back after, Easter, all the, your summer holidays, all of that. And it's always like when you take a break from exercise, which I encourage because you need the rest and recovery, it's like one step back to go 2 steps forward. But as soon as you come back from Christmas, it's not like you start where you left off. It's like you have to go back gears and then like build yourself up again. Do you know what I mean? So it's about it's hard whenever people have never felt it and they can't see it because they haven't been there. But it's really whenever they've been through the seasons and it gets easier because the curveballs have already been through those obstacles. Um,
Yeah.
if that makes sense. And I suppose as well, people need to be winning. They need to be winning in some shape or form, whether it's metrics based, whether it's personally, like how they feel. There has to be some form of winning. And I suppose that's where like it's like setting small, achievable goals. And then also
Hmm.
having a supportive network, which we chatted about earlier on. It's like being with like-minded people who are in the same position as yourself, similar, or have been through the position that you are currently in, and having that support and knowing, well, if they have done it and they have come out the other end of it, so can I. So it's about having that reassurance.
Yeah, I mean that all really makes a lot of sense. But it just kind of shows how much psychology is involved in it. It's not just a physical process of going to the gym. You engage very well with tuning into, the other things that go on in people's lives and the things that, influence their confidence and their motivation and all of that. Whereas, it's not just going to the gym and doing a list of exercises. It sounds like you're much more involved in the whole process than that, which is
Yeah,
really interesting.
I think like one thing, if you're doing something now that you can't sustain in 5 or 10 years or even further down the line, there's no point in doing it. Now, it's good doing challenges every now and then just to change things up and mix things up, but in the long term, the actual habits that you're looking to develop and establish should be something that you should be able to do like long term. So for example, we would get members that like have like, events coming up like weddings or holidays, whatever. Like I'm going on holiday in like 3 weeks. Like, what do you think I should do? And I'm like, well, enjoy the holiday or going to a wedding, there's going to be alcohol involved and there's going to be good food involved. And I was like, well, that's fine. Because over the long haul, it all averages itself out. And as we know, like when it comes to like equilibrium and stuff as well, as long as like they go back to their normal eating habits and stuff and exercise habits, the equilibrium eventually balances itself out. And that surplus calories it'll get burnt off for fuel. I always find it'll actually
Hmm.
help them to regenerate and recover. So it's like I always say to them, look at your food as fuel. So look at that occasion, whatever it is you're going to, that's fuel, rest, and recovery, but it's also a mental recovery for you as well to connect with friends, family, and appreciate the small things in life, which are so important
Yeah.
because that's going to pass anyway. So embrace it.
Uh-huh.
You know what I mean?
And I sometimes think too, it's like a mindset, of, actually, you want to enjoy the gym. You want to be looking forward to getting back to it and looking forward. It's not like a punishment. It's not something, bad. It's something that actually you want to enjoy doing and then feel good afterwards. And for me personally, I think if you get that kind of thing right, then that's what sort of motivates you and what keeps you going with it.
Yeah, I suppose it's like anything. Like you need a break from everything. It's like, your job, like, you take a week off your work and then you come back, you're refreshed and you're refocused and you're ready to go again. It's the same when the members take a week off and they go on holiday. They cannot wait to get back to the gym. Do you know, it's the same
Hmm.
thing as if they've had a break from it. And as well, there has to be something in the exercise that they connect with. We have different styles of classes. And there's different styles that different members like. Some of the members like the strength stuff. Some of the members like the sort of the high intensity type classes as well. And it's about coming back to that feeling of the endorphin release coming out of the gym.
Mm.
So the reward is never actually in the gym itself. It is potentially there and then in the moment, but it's actually the after feeling afterwards coming out with the endorphin highs. And even the next day when they're feeling sore and all, like they feel like, they kind of, it's like a love hate. Like they love to be in pain
Uh,
secretly because it makes them feel that they've
mhm,
achieved something, which they have.
mhm.
And then they look forward to coming back. And as you say, a lot of it is like the social aspect as well. They come in and they're chatting with their friends and then it's the community events as well. And I think as well, when they look back and they see the progress they've actually made, we do test week as well. So to see their lifts going up, they do progress pictures to see their body composition change in the in-body scans. And then if they haven't seen somebody in a while, then they turn around and go, "Hey, Fiona, I haven't seen you in a while. You look fantastic. What have you been doing?" And that's another major confidence boost. So it all
Mhm.
revolves back to confidence about how you feel. I
Mhm.
think anyway.
Yeah, I mean that's all of my questions that I had for you, and I think that's what I kind of wanted, to get from our sort of Q&A was to get a good sort of understanding of what you did at the Paragon gym and what your kind of approach was and stuff.
Yeah.
And it sounds great. I mean, if I lived in Belfast, I might come to Paragon.
Yeah,
And,
get a
it's good to hear that sort of whole rounded, approach to
yeah.
it and the sort of ideas and thoughts behind it and stuff.
I
So
think,
yeah.
but my last sort of point on that is, and I think it's really important, is it has to be fun. So like the programming, there has to be a fun element to it where people enjoy it for them to want to come back. It can't just be like a chore. I'm here because I have to be. There has to be an element to it that they actually enjoy and they look forward to being there
Mhm.
in each of the
Yeah.
classes, whether
Mhm.
it's the strength, whether it's the
Mhm.
burn, whether it's the Friday classes, there has to be
Mhm.
something there. And that's what we always keep it fresh and keep mixing it up so that
Yeah.
we basically give them like, it's like 80% need, 20% want. So the 80% is what they actually need to be doing. And then the other 20% is kind of the want, which is like the fun stuff. Do you know what I mean?
Yeah.
Like you're kind of
And I suppose
sprinkling that in.
Yeah, and I suppose we were talking about the goals were sort of, weight loss for most people, but mental health, but also hopefully our Q&A has kind of like shown as well for that group of perimenopause and menopause women, actually why, exercise really matters because we talk about it all the time, you should do this and you should exercise and you do strength and conditioning. But actually, I think if you understand why it's relevant and actually the sort of scientific sort of evidence behind it, then as well as making you feel good and as well as helping you lose weight, even if you don't lose weight, it's still, it's still good for you. It's still, improving all your long-term health indicators.
Yeah.
Like your bones, but also your cardiovascular system too. And that's something we didn't get onto. And that's something that is the commonest cause of death in women is cardiovascular disease in their 70s. Not breast cancer or any kind of cancers or anything, but heart attacks and strokes. And you can help decrease that risk by taking HRT, but you not necessarily you don't have to take the HRT. But if you have a healthy BMI and do exercise and are healthy, you can minimize those risks as well. So there's so many benefits to exercise in the menopause, apart from mental health and weight loss. That it just I think it just is important if you understand. People rant on about it, but actually there's a really scientific, sound basis to it.
Yeah. I love that. Like, so basically what you're saying is it's not just all on one particular area. So it's not like weight loss or scale weight. It's like the bigger picture. It's basically longevity of life.
Exactly,
Yeah, yeah.
exactly. Uh-huh.
Class. That
Yeah.
is
Uh-huh.
unreal. Well, do you want to, well, like bring it in? Anybody wants to ask any questions? I'm
Yeah,
guessing
great.
these are all here for Fiona. So, or if there is any for me, like work away. But yeah, if anybody has a question, unmute and work away.
Hiya, it's Heather here. Um,
Hi.
Hiya, a lot of online now about menopause. It should all be low carb. It should all be low calories, and the belly fat's cortisol. You need cortisol reset and all this. Is there any basis to those, or is all that just marketing nonsense?
Well, it's a big complex issue. I mean, cortisol is a stress hormone, and cortisol sort of has different impacts on insulin and stuff, and then it can cause this your body fat to accumulate in your midriff and stuff. And it makes insulin metabolism different. So there's scientific basis to cortisol. Cortisol basically is to do with stress. So if you are able to decrease your stress levels, you'll have less cortisol, and that'll help for that. If you have a healthy diet, so minimizing, all those like rubbish carbs, all those sort of fast hitting carbs, like your sugary stuff, and it just a lot of this has a lot to do with insulin metabolism. So if you have a big sugary refined carbohydrate thing, then it'll boost your insulin to try and decrease your glucose, and then that does all sorts of things to your blood vessels and stuff. So those kind of horrible carbs that I would call them, it's not good to have too many of those, but more ones like with like that's why the brown bread is better, and the whole grain pasta, because it's absorbed less quickly, so it has less effect on your glucose. So there's you shouldn't have minimal carbs, because that's not good for your metabolism either. You need to have a reasonable amount. Like your potatoes with your skins on and stuff. That's okay. It's about how rapidly you absorb the sugar and then what it does to your insulin. So there's some bases in the cortisol, but that's to do with stress,
Right.
and that's the exercise and how we manage stress. And not having a refined carbs, but you do need carbs, and you need fat as well. So things like your Greek yogurt, which is great for a protein source, but you don't need to have 0% fat. The Greek yogurt, you need the ordinary Greek yogurt is good, and it helps absorb fat soluble vitamins. A really interesting resource, if you haven't looked at it before, which explains all of that, is I don't know if anybody follows the Blue Zones. So the Blue Zones is this really interesting program, and there's a book about it, and it's on Netflix. And basically, it looks at the places in the world where people live the longest. So this guy, a Canadian guy, goes and visits these 9 or 10 places in the world where people live the longest, and he finds a common thread that helps them live the longest. And basically, it's their diet. So they don't eat refined foods. They eat, it's like the Mediterranean diet, except it's in Japan, and there's an island in Greece and an island in Italy. And they exercise, like the people are living till 100, but they climb up the hill to mass or to the market every day. It's functional exercise. So I think my point there is it's a good thing to look at, because it gives you a good idea about a healthy diet. A lot of those things that you look at, they're selling different products. I don't think you need any of that. You need a pared back diet, like they talk about the caveman diet.
Yeah.
With all of the nutrients that you need, but none of the refined kind of rubbish with the preservatives and stuff in it. I don't know if that answers your question.
Yes, it does. Thank you.
Yeah. Anyone else?
Yeah, just quickly, and it's kind of related to what Heather asked and sort of related to your answer.
Uh-huh.
Um, you were talking about reliable resources, you know, to,
Yes.
yes. Can you recommend any reliable resources? Because I think a lot of women here, like Heather saying, we're getting
Uh-huh.
fed things through
Yes.
feeds. I
Uh-huh.
mean, once you Google something, then it comes
Yeah.
up in everything, and we
Yeah.
all are getting, you know, we're all getting hit with cortisol and take this and
Yeah.
all
That's
of
it.
these,
Yes.
you know.
That's a super question. There's so much information, and among sort of colleagues of mine and stuff, we'll all be, picking up on that and noticing that just everybody's getting in on the action with what they can recommend about menopause. Um, and I suppose when people are trying to sell things, then that's the giveaway. But I suppose if you've got menopause doctors on, they're maybe looking for you to go for appointments or whatever. So it's, there's money involved somewhere. But if there's a sort of hard sell for something, then I'd be looking at what evidence they have for it. So my one thing that might be relevant to some of you is collagen. There's a lot of stuff selling collagen. There's no good evidence behind any evidence for collagen working. So collagen is basically an expensive form of protein. So you see these Instagram things that recommend collagen to help your skin, and it's mostly cosmetic. Is what they say for collagen. Sometimes they say it's to help with your connective tissue or your muscles or whatever, but it's mostly anti-wrinkles and all that kind of stuff. So collagen is an expensive form of protein. It gets brought into your system, broken down into amino acids, and then rebuilt into protein in your body. So I definitely wouldn't go for any of those. Back to what you're really asking, reliable resources. So the Women's Health Concern is a branch of the British Menopause Society, and it's the patient branch of the British Menopause Society. So if you're looking for reliable information, I would go for that. I usually try on my Instagram post to kind of post about topical things people are asking about, that are in the news, and kind of put the evidence for them. So keeping an eye on that. The
Yes.
other one that comes up a lot, you'll find in social media posts, is testosterone. And yeah, usually that's because somebody's trying to sell you something on that. And there's a lot of good information on that Women's Health Concern website about testosterone. And it's more kind of scientific and evidence based. So yeah, the Women's Health Concern would be my main one. Um,
And
yeah.
yourself
Well,
and
I
your
like
own.
I would like to think so. I mean,
Yeah,
that's
yeah.
yeah,
You,
I mean,
I
that's the
know.
whole
Yes.
that's the aim of that, and it's
Yeah.
not really, I'm not really
Of
advertising
course.
anything. It's
Yes.
it's topical issues, and hopefully, guiding you to resources that I think are useful depending on a different topic. Because I don't know everything about everything. So, I'll mention things
Yeah.
about, some good resources for sleep or some good resources for anxiety or things like that. But it is difficult because, people are, when women are feeling awful because they haven't managed their symptoms, you'll pay any amount of money,
Yeah.
so it's exploiting kind of vulnerable, um, women who are looking for the best advice. So yeah.
Well, that's why I'm here, and the collaboration is brilliant because you don't know where to turn. You don't know.
Uh-huh.
You know, I did have a nurse say Google it, you know, and then I just was more concerned. I was more
Yeah.
confused. Sorry, Fiona, I was more
Yeah.
confused, you know. But that's
Yeah.
very interesting because I think most of us are taking collagen.
Is that right? Really, really, it can be expensive, and honestly, that is the truth. I have spoken to dermatologists about it. That we have, forums of menopause specialists talk about it, and there
Mm-hmm.
is no evidence. I don't know if any of you know. She's a dermatologist from actually Belfast who's done very well recently. Dr. Sam's products.
Mm-mm.
And I was speaking to her a while ago about that as well, and she's a dermatologist, and she's she agrees with that. The other point I was going to say when you said about Googling it, that one of our challenges in medicine, not just to do with menopause, but in all areas now, is AI. And we're getting so many people, it's similar, I suppose it is a Google extension, isn't it? So many people coming along saying, like AI says this about my symptoms, what do you think? And they're
Yes.
approaching us as a second opinion to AI. So that's going to become a big thing. And, no one to, as you're probably thinking, no one to take that with a pinch of salt. I mean, you can get some good information, but you've got to be skeptical about, whether it's true or not, because, yeah.
Yeah. Thank you, Fiona.
You're very welcome. Yeah. Anyone else?
Hi, Fiona. It's Margaret.
Hi. Hi.
My question is with regarding HRT. Is there a time limit? And is there a cut-off age where you're supposed to stop, or can you continue taking it for as long as you want?
Great question. So, and that kind of goes into a part of Dave's question, which we didn't get to complete about. I think he had said, is there any harm in delaying treatment with HRT? And it's all into that timing aspect. So effectively, what you need to think about HRT, you need to remember. So it's hormone replacement therapy. So it's replacing what your body used to produce. And the hormones we use now are body identical hormones, very different from the hormones way back at the start. So we're replacing your hormones that you used to produce with the same hormones, but at much smaller amounts. We never get to those high levels that you would have had when in normal cycles. So it's there's no age limit or time limit for when you're on HRT. If it doesn't matter what age you start it, it's about your symptoms, and it's so. The problem is, suppose sometimes if you start it, then your symptoms are masked, so you might not know when to stop it. But you're also then thinking about the long-term benefits to your heart and your bones, so you might not want to stop it for any of those reasons. So reasons for stopping it might be sometimes if you're on it for a long period of time and you're older, then the risks of breast cancer start to increase with HRT. Now those risks are very, very small. And if you compare those risks and relate them to your symptom relief and your heart benefit and your cardiac benefit, then it's a balance of symptoms of benefits versus risk. So and also as you get older, benefits to your genitourinary system. So really your vaginal health and your risk of urinary tract infections, which can become a problem. So really the answer to your question is there's no time limit or age limit. And as you get older, you're starting to weigh up the benefits versus the risks. And does that answer your question?
Yes, yeah, it does. Yeah, I've been on it for quite a while, and
Right. Yeah.
one of the doctors was trying to take me off it, but I didn't want to come off it. So I've no risk factors, so he was happy to let me stay on it.
Yeah, so that's a really common thing that women might come to see me because they've been told they're too old for HRT and they've got to stop it. And then they stop it and their symptoms come back and they feel awful. And their doctor says, you can't restart it. And that's just not correct information. That's just not correct at all. But there is some basis to it in that way back in 2002, there was a big HRT scare and everybody stopped HRT because it was reported that it caused heart attacks and strokes and breast cancer. So then the guidance at that stage was that you could go on to HRT at the lowest dose possible for the shortest possible time. Then they reevaluated all of this, and that study was proven to be incorrect. And they were using different hormones than we use now. So we use pretty much, by and large, body identical hormones. And the women in that study were actually all, strangely, it sounds mental to say that it was misinterpreted, but they were all American overweight women in their 70s, late into the menopause, who had high risk factors for breast cancer and heart attacks and strokes. So basically, that kind of idea where somebody's saying that you've got to stop HRT at 60 is still a backlog from that old idea way back. So believe me, there is no issues in staying on HRT unless you develop unless you develop breast cancer, and then that's a different story. Or there aren't too many other reasons why you would have to come off it, to be honest. We use transdermal HRTs now, sort of, gels and patches and things because they have no risk of blood clots. That used to be a concern as you get older, blood clots would be more common. And then if you're on HRT and you were older and it was a tablet of HRT, then that would become a problem. So there's very little issue about that. But for some older women who want to take it, you can always take the vaginal estrogens, which becomes uh, more of an issue when you're older. And vaginal estrogens protect your kidneys and your vaginal tissues and have no absorption. So they're not really like a traditional form of HRT. So some women will stay on the vaginal estrogens and not take HRT.
Okay, thank you very much.
You're welcome. Any more questions? Yeah, I mean, there's a lot that to know and to talk about menopause and HRT. So hopefully we've covered the bones of it and um, sort of emphasized how it relates really to menopause. But yeah, there's lots of questions, lots of different types of HRT, lots of different problems you can run into with lots of different types of HRT. But there's usually lots of ways that we can solve those problems. Um, so um, so yeah, hopefully that's stimulated lots of conversation for you, and you'll be a bit more armed with the correct information.
Thank
Fiona,
you.
thanks very much. I think before we go, I think it'd be good if everybody just gives like their number one takeaway. And also before we do that, Fiona, like where can everybody reach you at on your socials? Like where like obviously your Instagram handle, your Facebook, if you just want to give that to
Yeah.
everybody as well, I
So
think that would be really
yeah,
Yeah.
beneficial.
yeah. So the Menopause Medic Glasgow Instagram page is really the best way to see my info and to see my contact details. And Hollywood Private Clinic is where I work out of, and I do Zoom consultations and face to face there. Um, at the moment it's one Friday a month, but that's maybe going to be extended. So if you wanted more input, more information, then you can find it from the Instagram page, or I'd be delighted to see anybody at the clinic. And hopefully I might be getting a wee bit of a visit to the gym at some stage, and be getting a wee bit
Yes.
more involved. So I'm always available for a wee bit of chat. Yeah, about menopause. It's genuinely a fascinating subject, and it's always changing. Over the last 5 or 6 years, there've been so many new developments in treatment and in studies, and there's just so much more good noise about it. Over recent years, it's a good topic, but things are changing all the time, so you need to keep on top of it, which is part of the Instagram pages. Purpose really is to keep on top of all the changes.
Brilliant. Love that. Well, Jennifer, do you want to start with you? We'll just work our way down the screens, or if anybody just wants to work away, just your number one takeaway from the call. And the benefit of this is for both me, for both Fiona and I, for our own sort of knowledge as well. It's just to like figure out from these calls like what has been kind of the most value, so we can continue to, because it's something I probably would like to continue doing, at a later stage. So like the biggest sort of takeaway points that you've got from this here would be really benefit us if you want to share them with you. If, yeah, Jennifer, do you want to start?
Yes, I'm happy to share with the group, Dave, that and Fiona, that I'm a patient of Fiona's, and I met her a number of years ago, so I can certainly recommend this lady to you. She changed my life, and one of the
Oh,
last appointments I had with her, we talked about strength and conditioning exercise. We talked about eating more protein. I didn't know where I was going with that. And then my husband found Dave on Facebook, and he talked me into then joining Paragon. And I can just say, honestly, I'm hanging on to 56 by the skin of my teeth, and I've never felt better in my life. So
Well, that's
thank
just
you to both of
fabulous.
you.
Well
That's
done.
fabulous to hear, Jennifer. I'm so pleased. That just means the world to hear that, and I'm delighted that you've got a whole sort of treatment plan and way of kind of getting through all of that. And it's a really good example of how different things all come together. You've had Dave, and you come see me, and your husband found program and stuff. So yeah, I think that's the way it's meant to work, and it's great to hear when it does. So thank you very much.
And I think the other thing was I was that patient who had gone to my GP and maybe didn't get the support that I needed from other doctors. So I can say to the ladies here that it is well worth going to a specialist. So it is. So thank you, Fiona.
Thank you, thank you.
Well done, Jennifer.
Well, that was brilliant. Nolene, go ahead.
I'm not an Instagram user, but I'll have to get used to it because I do need to follow your page, Fiona, and keep up to date with everything that's going on. I'm not sure about menopause. I don't even know if I'm having symptoms or not, but I thought I was, and I honestly didn't know where to go with it.
But I
did speak to your nurse, was told to Google it, and I was more confused. So Dave doing this, I'm bringing you in, Fiona. I don't have any major issues with it, but it's just knowing. I'm obviously of the age, I'm 53, but I will be keeping an eye and educating myself on it.
I'm dying to butt in with that one, because there's very little harm from anyone trying HRT. So unless you have a family history of breast cancer, is probably about or there's some medications you might be on. There's no harm in trying it. It doesn't do anything bad. It can sometimes be hard to work out the symptoms. It can be sometimes hard to work out your sort of menstrual history. But and without going into your personal issues, if you're 53 and you think you're having symptoms, well, you will be, because you're 53. And and if you think you're having symptoms, you know just try HRT, because if you've got no medical reason not to do it, you actually, number one, for your symptoms. But actually, I forgot to mention about this window of opportunity that we have for cardiovascular disease. So to try and prevent the risk of heart attacks and strokes, you've got to take the HRT in the perimenopause. If you take it too late, you lose that benefit. So if you haven't tried it and you don't have a reason for it, I think you should go and get it straight away.
I just am not sure about the symptoms, but everybody says that obviously I would be.
Yeah.
Look, you're not going into the cardiovascular into too much detail, but can menopause cause a heart attack?
HRT decreases your risk of having a heart attack, and that's because of the
Interesting.
menopause. And that's
Interesting.
because in the menopause your estrogen levels go down. So I mean,
Interesting.
it's so interesting. Women have heart attacks at a later age than men. That's because they're protected for a while. And then once they get into the menopause, the rate of heart attacks and strokes goes up in women. So it's a big factor. So if you think you have symptoms and you're 53 and you haven't tried it and you've no reason not to, I think you should go and try it. It's a pity you're not on Instagram.
I am. I can go on it. Dave's challenges has forced me to go on it because you have to get
Is that
points
right?
for posting Instagram posts. And that's
Because
the only time I've ever been on it.
if you like, and I'm sure Dave could show you or somebody could show you,
Yes.
you can send me a wee message on Instagram and I'll go into that in a wee bit more detail.
Yes, I would really appreciate that, Fiona.
I think it would be great if you were to try it. Yeah.
Yeah. I did suffer a heart attack. I'm only telling you because Dave's laughing.
Right, okay. Right.
Oh,
I'm only telling you for the giggles. It wasn't very dramatic, Fiona. I'm only telling you for the giggles in front of Dave.
You had a heart
in the
attack.
gym.
Did you?
I did. I did.
Well,
Complete.
that's
I'm only
interesting.
saying, I'm not going into personal details, Fiona. I'm only
No,
saying it for the laughs and the
no.
giggles. But I
Well,
actually suffered a heart attack in the gym. I hadn't started working out or anything. It was nothing to
did
do with the
I?
exercise. While Dave was standing in front of me.
Okay, so you need more of a conversation. Yeah, you need more of a
There was
conversation
no
about that.
reason for there was no reason for me to have the heart attack. There was nothing wrong with my heart, and it was put down because I was 52. It was put down to menopause. So, and I'm only saying because I thought Dave was going. I didn't know I was having a heart attack, but I thought Dave was going to have a heart attack.
Okay. There's a lot. Maybe we should message about that because there's a lot I can say
I
about
would
all that.
appreciate that because that's where
Uh-huh.
it ended. That's where all the information ended.
Right. Okay. Yeah.
Yeah,
Yeah.
yeah.
There's loads to talk about with that. Yeah.
Yes.
Class.
Thank
It was
Okay.
you,
the workout.
Fiona. Thank you.
It was
Yeah.
the workout on the board. It was the workout on the
Super. I
board.
mean, I do often get worried about that in the gym myself. I think something bad's going to happen to me, get all lightheaded and all my pulse is way up and yeah. But yeah, that was a bit of a scary
Well,
experience. So I mean,
I'd only walked through the door. I hadn't even warmed up. So it wasn't, I'd hate saying it in case somebody says I'd overdone it or something, or, but
uh-huh.
it was nothing to do with the exercise, you know.
Oh.
Dave's face.
Oh, brilliant.
Just out of
Well, if there was a
interest,
good place to have it, that was the best place to have it.
Yeah.
I presume, do you have a defib in the gym, Dave?
No, it wasn't. It was straight into the W position, and I think my heart stopped as well for a while. I think I took
It
a heart
wasn't
attack.
like, I only felt a wee bit sickly. Like it wasn't like or anything, but Dave turned grey.
Honestly, Nolene, that's another really interesting fact because women
Yes.
have different symptoms of heart attacks
I
than
think
men.
it's important to say that. I
Yes.
didn't know I was having a heart attack. I
Mhm.
didn't know.
Exactly. Yeah.
And Dave insisted that I went home, wouldn't let me get into a car, which is another really good thing. I thought he was being ridiculous because I
Mhm.
just didn't feel well. It wasn't that I was
Yeah.
in pain or anything.
Yeah.
My husband came to get me. He brought me to A&E and they said, "You're having a heart attack." But I had no idea. I think Dave knew it was serious by the look of me, but I couldn't see myself.
Yeah.
But
Anyway, I'm glad you asked
I'm
that. I'm
fine.
glad
I'm
you told
fine.
us that. And there's definitely we'll have a follow-up conversation in
There is
some
a
shape or form.
conversation to be had, Fiona. There is a
Uh-huh.
conversation to be had, yes.
Okay,
Thank you.
great.
Uh,
Um,
we'll take a couple more and then we'll wrap it up. Does anybody
yeah.
else want to give like their biggest takeaway and then we'll go a couple more? Yeah. Or is that it then? Is anybody
Dave,
else? Heather?
I'll just
Yeah.
jump in there. So, just a bit of background for me, Fiona. This has been really beneficial for me just in the past 6 months. I am only turning 40 here in a couple of weeks. And my
Really?
doctor
Right.
has told me that I have perimenopause symptoms. I knew myself going, wasn't expecting it, and it's something I've been really struggling with for about 6 months.
Uh-huh.
Thought it was very taboo. And this has just been, I just want to thank yourself and Dave for providing this because just being in a community where it's talked about so openly has
Absolutely.
really
Uh-huh.
helped me just to go, this is just normal, it's fine, it's just part of life. So thank you both very much.
Yeah. Oh, that's good to hear. And are you on treatment or
Not currently, I'm just tracking a lot of things and I have another review. It's actually just after my 40th birthday, so it's on the Monday, the 7th of September, I have another wee review to go in and see my GP.
all right, okay. Yeah, it can certainly happen. What, 1% of women have menopause under the age of 40, so it's not common. But yeah, clearly well yeah, just make sure you get the right treatments and
Yeah, I think it's
yeah.
just an ongoing thing, just having a wee, just keeping, this has been very informative to me to know what to look out for and things that you said that maybe I wouldn't have associated with it before, like certain symptoms that I wouldn't have thought. And there's a few wee things going, right, okay, that's, it's just, I find it very interesting, just took in an awful lot there. So thank you.
Again, there's nothing to be scared of. It's
Yeah.
not, going on to HRT, it might well make you feel better. And if it's very early stages that it doesn't make you feel better, then you can stop it and try it again. It's not a really harmful thing. So hopefully you'll get those symptoms sorted out, and I'm glad you got some useful information. Yeah,
Yeah, no, thank you very much.
you're welcome.
Right. Anyone else?
Hi, it's Joanne here.
Yes. Go
Hi.
ahead, John.
It was great listening to you because I am coming 50 this year and everything's hitting me all at once here, all the symptoms. So, and talking about the HRT, I have breast cancer in my family.
Right.
So I was going to go and see the doctor about this, but hearing this now is maybe HRT maybe isn't for me. I don't
Oh,
know.
no, that there's a lot going on with that. So it depends on who the family members were and what age they were and things. So it's not a blanket no at
Yeah,
all. I've certainly got women on HRT who have a family history of breast cancer. So it's a discussion to be had, but it's not a no. And
all
it's a
right.
really important point that you've made, because if you don't take HR, if it's worked out that you can't take it, or you're not keen to take it, you need to make sure you optimize everything with your bone health and your cardiovascular health, and find other ways to manage symptoms, rather than just be thinking, well, that's it and I can't take it. First of all, make sure you can't take it, and then work out other ways to manage the symptoms if that's what the decision is. Because yeah, and it's always, there's very rarely a yes or no.
Yeah.
It's very often a balance of risks and benefits, which is a discussion that you need to have.
Okay, thank you. Thank you very much for the night.
Yeah, welcome. You're welcome.
Well, I think we'll wrap it up there. I appreciate everybody's input. Fiona, thank you so much. I think everybody give Fiona a thumbs up. Like, you are the main star in this tonight. So
I'd say you're a bit the star too, so
yeah.
thumbs up to you, and thank you for inviting me.
Oh, no, no, absolutely. And Fiona, definitely we get you around to the gym. I was thinking of bringing Fiona around, and we could do a Pilates class with Fiona, or it was even like, out for like a walk or something with Fiona around in the gym. If everybody, like, we can set a date whenever it sort of suits everybody, and we get to meet
Mm-hmm.
up live in person. If
Mm-hmm.
that's something that you're all interested in, I know myself and Fiona are definitely keen to do it. Like, so, I'm just from based upon these conversations tonight, I think it'd be very benefit to you all, very beneficial to everybody if we could all meet up in person very shortly.
Yeah, great.
All
Great.
right.
Okay, well, like, thank you, everyone.
We look forward to
Lovely to
meeting
meet you
you.
all. Yes, you
Thank you
too.
very much.
Thanks very much.
Bye.
Bye bye.
Bye-bye.
Bye.
Bye-bye.
Bye bye.
Bye.